Okay, to start an IV, you would check the medical order for the IV. Then you would gather your supplies, which would be a towel or a pad. It would be either the IV bag or solution that you're going to use. In this case, it's a saline solution. You would gather your catheter tubing set. You would gather the IV kit. You would get the 18 gauge needle and catheter, and you would identify the patient by their wristband and ask them to say their name and date of birth. You would introduce yourself, explain the procedure to the patient, and then you would wash your hands and then set everything up. And you would provide privacy for your patient, and you would put the pad underneath their arm in case there is any leakage. Okay, and then you would open everything up. I'm going to go ahead and flush the tubing so that way there is no air bubbles. Okay. I'm going to go ahead and pull 4 or 5 pieces of tape. Tape ready, that's ready, and then I can go ahead and see where I'm going to find a good vein at. After that, I'm going to apply the tourniquet to the patient. Okay, then you would take the alcohol prep pad and you would clean the site for 30 seconds. Then after that, you can go ahead and apply gloves. Make sure the bevel is up, and you want to anchor down the vein. I'm going to do it this way, and then once you see blood return, drop the needle and advance just a tad bit further, and then you can advance the catheter all the way into the vein. Okay, then you can put a gauze underneath, and then you want to pop the tourniquet, and then put your finger kind of above where the catheter is so that way there isn't much blood spill. You would remove the needle and either do the safety device or put in a sharps container. You can remove the gauze. My cat's sneezing, I'm sorry. Apply the IV tubing or flush, whatever you have to do. And then you can release your pinky finger And at this point, I would take a piece of tape and tape down. Okay, you can kind of release. And apply. Okay. Make sure that the IV site where the catheter is going into the skin is visible. Okay, and then you can place tape around it. Okay, and then you would start the IV fluid and make sure that there is no infiltration further on into the vein. You would also label it. You can label it with one of these little stickers and put the date, time, gauge, and your initials onto the actual IV site. And then you would position the patient back into a comfortable position. You would dispose of all of the equipment that you used, and then you would tell the patient if there was any movements that they couldn't do to dislodge the IV. And then you would wash your hands and you would document the IV site, the gauge needle and catheter, how well the patient tolerated the IV, and how many attempts that you tried to do the IV. And that should be it.